Are you considering fillers to enhance part of your body, such as buttocks, hips, or calves? Here at CREO Clinic, we're the only practice in the UK to introduce the ultrasound scan with HYACorp in these procedures. My name is Omar Tillo, plastic surgeon specialized in body contouring procedures. In these short videos, I'm going to tell you everything you need to know about HYACorp body fillers. What are HYACorp fillers? So HYACorp is a type of hyaluronic acid filler which is designed specifically to augment specific areas of the body, such as lack of volume or concavities, more commonly used for buttock or calf augmentations. How do HYACorp fillers work? HYACorp is a viscous gel. When we inject it into the area, it enhances it by adding volume, and also at some stage drains some water, which makes it swell. Some people advertise it as lasting for 18 months. However, from my experience, I found that it can last for up to a year. So what are the reasons to use ultrasound scan with the HYACorp treatment? We are at CREO Clinic are the first to use ultrasound scan in HYACorp injection into the buttock. And we do it for two main reasons. Number one is efficacy. With the ultrasound scan, we make sure that the HYACorp is injected deep enough under the superficial fascia, and that will give the maximum expansion effect. If it's injected too superficial under the skin, it works the opposite, so it flattens the skin. So it's important to inject it in the right place to get the best outcome from it. Second reason is safety. With ultrasound scan, we check that we're not injecting the fillers in the wrong place, such as a blood vessel or close to one of the nerves, which can have serious consequences. So how does HYACorp compare to fat transfer? There are three main aspects to consider between the two. First is longevity. So fat transfer is permanent. Once the fat is transferred and taken, that stays for life. However, with the HYACorp, it tends to be temporary. It can last, in my experience, up to a year. Secondly is efficacy, or how much volume we can, in terms of the results. With fat transfer, I tend to transfer up to about 1 liter to each buttock, which is 1,000 cc. With HYACorp, and with each transfer, we're limited to about 100 mils to each side, and we can build it up gradually. And lastly is the downtime. Obviously, the fat transfer is a surgical operation which takes a few days or weeks to recover from surgery. HYACorp is minimally invasive intervention which can be done in clinic with very minimal downtime and almost no time off. Who's suitable for HYACorp fillers? So HYACorp filler is a very good option for patients. Either they don't have enough fat tissue to achieve the enhancement they want, or in those patients who want a modest or mild enhancement. And thirdly, for those patients who don't want prolonged recovery time and they want the very minimal downtime.